even though I had the honors and the primary set up, doesn't mean that I had to use it. Some people tell me it's like, oh, you went through the effort of that. But for me, it's like, I took out quite a lot of experience from that too. It wasn't just about specializing, right?
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Laurence Doan, and today we're joined by Dr. George Chen. He was born in China but grew up in Sydney, studied a Bachelor of Oral Health in Sydney University before transferring to study dentistry in Adelaide. He's a 2017 graduate with concurrent honours degree in Geriatric Dentistry. He moved back to Sydney as a first-year graduate and completed the Primaries exam while working in private clinics around Sydney. Recently starting his own clinic, Oaks Oral Care, last year in 2020. Dr. George Chen, welcome to the show.
Hi, Lawrence. Thanks for having me here.
So for some of our viewers, me and George, we're good mates back from Adelaide. We kind of graduated together, so full disclosure on that end.
Being a journey, hasn't it?
Yes. So tell us about your CPD journey so far.
First year out of uni, came back to Sydney. There was so much that we could do. There's so many people that I talked to that they want to get into so much CPDs at the same, have everything done at the same time. For me, I took a bit of a slow approach. There were CPDs that I looked into in the first year, but I don't think I delved into a lot of the, say, major dental stuff like quite early on. It was more honing on the basics. And, you mentioned the primaries, I had that done in the first year, but there was a lot of different CPDs I dabbled in. It ranged from communications to like just basic general dentistry, a bit of practice management, because at that time I was like thinking like, if I ever were going to look into managing a practice, either way, it would have been a good skill to have. It's part of our work, whether we like it or not, right? We can't just always just focus on a tooth and then how to treatment plan it. Although it's important, but there's going to be other aspects to that, and not just working. So yeah, I'd say it was a slow but a steady start for me, in the beginning. Yeah.
Fair enough. Yeah. I mean, look, hey, we kind of graduated. We kind of jumped into prime communications, prime speak first, and we kind of did it together. What was like for you?
Yeah. Prime Speak was one of the communication courses we started with. It was a lot of people were recommending it, but I know also for a lot of people that have different opinions about it. For me, I reckon it was really good that I took away some aspects of it that made it work. And just in terms of tailoring treatments, getting patients to accept treatment plans. In my opinion, the course or the strategy that has works pretty well, but it depends on how you want to use it and how do you want to apply it, because as I said, everyone has their own communication method, and if you're going to be hard forcing one way just because you learned it from a course doesn't mean you're going to get that result, right? So I think like if anyone's going to be taking it or have done the prime speak, you probably know what I'm talking about. But just what you can take away from it and apply it, it's probably you just want to focus on that rather than being like just using a one recipe cookbook for everything. Yeah.
Yeah, no, I agree with you. There's always going to be a few things that you kind of take away and that you can apply naturally to the way that you communicate. Because if you look at it and as if it's like a recipe cookbook, you're just going to come out like a robot.
Yeah, because we do have a focus on communication in uni. As you've mentioned at one of the podcasts before, we actually have a pretty good foundation with the communications in Adelaide University. And I know a lot of our other colleagues that's being from the other unis, they probably don't have as much of a focus. Of course, we took it for granted and probably could have taken more advantage of it. But now, we're out in the world and just looking for courses that can develop our communications. But I mean, it's one of the biggest aspects, whether you like it or not, in dentistry. Like first year out, you're starting to see patients, you're talking about money and talking about payments, accepting procedures. It's not just is it good for you or not? It's so many other factors. And, if you can't obtain that as your basic, or essential tool to communicate with patients, you're basically left with no patient for you to be able to treat, So yeah, so I think that that's pretty important. And that was one of the reasons why, we looked into it in the first year, just to establish that basic skill. Yeah.
Yeah. I mean, one thing that I probably noticed when I was talking to colleagues as well, was that in Adelaide, when we talked to our patients at the hospital, we already had, like the patients had to pay a small portion, a nominal fee, which is different to when we did our placement in New South Wales, and, patients weren't paying a fee. And so that initial jump might be a little bit different for a recent graduate that might be coming out from Sydney.
Yes. Yeah.
So let's talk about, so after you did the Prime Speak, what kind of CPD did you want to dabble into before you jumped into your primaries?
There was a few other small CPD, like weekend CPDs, and ones that you can go for a day. I definitely took advantage of the ADA programs and what CPDs they offered, and even some webinars online at the time. So I'll say more so general dentistry, like getting my fillings, restorative dentistry a bit better, honing a bit more skills on that. Some endo CPDs. And I think one of the bigger ones was occlusion. There was a talk by Dr. Michael Milkis, who's from the States, but he's from the RIPE, RIPE, the group. And it was a really good fundamental CPD that I took from it, because if you think about occlusion, I thought let's find one CPD that will change your perspective on general occlusion, because you'll need it eventually for everything: full cases, dentures, pros, fillings. Everything comes back to occlusion in a way. And I thought, what, it's really good to review this. But after I went on that course, which I had to go to Melbourne for, it kind of opened my eyes and perspective in terms of there's so much more going on here. It's not something that you can just do in one go and leave it. It's more like, every year, every time you get a chance, just go back into some sort of occlusion courses, or I'm using occlusion as an example, like just repeating some courses, right? So you can just hone in that skill, because even with Prime Speak or communication courses, you can do it once, but it doesn't mean it's going to retain with you forever, right? No one's perfect in that way, right? Yeah.
Yeah, no, I agree. When we did it together, when I went in and I came out, I had more questions going in. Exactly. I had more questions coming out than going in.
The more you know. But I was actually surprised. I found out during that course that there were practices that were kind of getting their own dentists and staff and receptionists, and anyone that's even non-dental, just in the practice team, going in there and at least once or twice a year, and every year. And I'm thinking wow, just imagine how much skills they can obtain from just repeated learning. Yeah.
So then after you're doing all this, you're deciding you're going to do the primaries. So talk to me about that, and how'd you find it?
Primaries. I mean, a lot of people at that time when I did it, when I took on the primaries, I was like, oh, why are you putting yourself through this, or decided to do the primaries. It's not compulsory. For those that don't know, the primaries, leads your way into the fellowship. And it comprises of 6 main core subjects, and they're basic subjects that you learn mostly in uni, and it's comprised of a theory and then also a viva component. So you take a lot of time out to do that. At that time, my rationale was I wanted to have an option there, right? If I wanted to specialize in the future, at least I've got the primaries under my belt, and I don't really need to kind of go backwards, set time aside when work gets busier to actually get the primaries done. It's more like, first year, this is perfect timing. I'm not seeing that much patients, because you're building up your patients initially in the first year. So why not? And everything's fresh in your mind. I've had also people telling me 5 years out of uni, they're at that time to me, I wish I did the primaries earlier, because like now I find so much passion for a certain like category of dentistry, like endo. And then like I wish I had that done so I can just go into specialty now. But like because they haven't, I just didn't want to not have that option by then. So yeah, hearing from other people their experiences few years later on, and also like I'm thinking this will be really good since I'm concentrating on everything that builds my foundations from the bottom. This was just a really good start. So I went with it. Yeah.
So a lot of people, when they pick primaries, they're thinking about specializing. I mean, you did an honors, and now you've completed the primaries. Were you thinking about specializing?
Yeah, I mean, for sure. Like, there was a point where I was thinking I want to specialize, but see, I came out thinking like I want to do a bit of everything, right? Like everything was interesting to me. We had so much good specialists that were our mentors and tutors in uni, and it just everything seemed interesting. And I didn't want to just come out of uni, start working, and be like set on one goal, right? Like I just wanted to be explore a little bit in terms of what I could do or provide in dentistry. So after the first year, after primaries. I realized that, you know what, there wasn't one thing that I wanted to do in particular that I really, really was passionate about. So like, because like, I just felt like I had a bit of passion in everything. So because of that, I didn't want to restrict myself. So even though I had the honors and the primary set up, doesn't mean that I had to use it. Some people tell me it's like, oh, you went through the effort of that. But for me, it's like, I took out quite a lot of experience from that too. It wasn't just about specializing, right, as an end goal, right? So yeah, that's the way I see it. Yeah.
It made you more appreciative or understand to a deeper level
Yeah.
about the things that we were doing, would you say?
Yeah, for sure. Like and now like when I talk to special or know people that are specializing, like I kind of know and understand the struggles they're going through. Like for the most that had to go through the primaries, I'm like, wow, like, it's definitely a struggle because I've been there. I can relate with that. Yeah, and on top of that, like with the primaries, it's a huge amount of chunk of your year. Like you have two full-time weeks, sorry, for the course itself, and then you need another 2-3 weeks for the actual exam and preparation for it. So, I mean, it's a lot of time. Yeah.
So you completed the primaries, and then what are you deciding now? Because you're kind of realizing maybe I don't want to. It's not too specialized, but I want to kind of dive into other stuff more.
Yeah, so because after the first 1 or 2 years, I realized like, you know what, general dentistry is really going really well for me. I want to learn, different specialties, like in terms of like ortho, implants, surgicals and stuff like that. But I didn't want to do that as the only thing for my job. And since if specialty pathway wasn't something that I was going down with, I was like, practice management, something to continue to still upskill myself. So I did have a really good opportunity with another dentist I used to work for, who's retiring, and they needed a dentist to take over and take care of the patients that he's acquired. And he didn't want anyone; he just wanted someone who had the same alignment in terms of goals with his practice. So it was just a really good opportunity and timing. So I got to get that and go through that experience and learn a lot too. So I'm glad I went to some practice management courses in the first year. Hey.
So talk to me about that practice management courses. Where did you come across that, and what was it in particular?
So it was won by the ADA. I felt like maybe I was expecting a bit more of like, how you run your practice, but I think when I took on the CPD, it was a bit more about the business side. So I guess like it didn't answer all my questions. And obviously like coming out first year, like you don't want to be, so focused on just like the practice side, management side. Like that's something that does come later on, and I didn't expect it to be so fast in my career, my pathway to be in this position. But at the same time, I feel really fortunate with that. But it didn't stop there. Like there's a lot of people that I talked to, previous bosses and colleagues, and I learned just as much from them in terms of like just practice management, right? Just like you're learning to drive a car, no matter how many manuals or YouTube videos you watch, you won't learn until you actually drive the car. So I really believe that. So with practice management, that comes along with it. Like you just have to be in it before you actually learn. Yeah.
Yeah, I mean, like, I think when we talk, and we see from our friends as well, there's a particular point where they reach a point where a clinician starts to contemplate about practice ownership, being a specialist or a super GP or even starting a family. I mean, can you share your thoughts on that?
Yeah. Yeah. I always like the idea of a super GP. It's like that's what everyone wanted to be in a way, right? Um, but yeah, of course, like your career focus has to come first, before you start spreading thin, I guess, and get distracted with other things in life. But like my opinion with that is, I think I would have liked to practice dentistry a bit more, or like feel like a bit prepared. But I think like everyone would never feel 100% prepared on whatever they do. Imagine your first implant case, your first ortho case. No matter what you do, you're not gonna feel 100% prepared. Like I'm ready for this. So, um, yeah, for those people that are thinking like, what career or like what path to go down for, just know more about yourself first, I guess. And like, as I said, like basics is going to be very important. Get your fundamentals in before you start exploring what you want to hone in onto. And for me, because one of the practices I started working at, they didn't really have a really efficient receptionist, or like, we were a bit like understaffed. So it was a lot of I guess the payment admin side fell on me as the first 1 or 2 years. And I was, now looking back, I'm quite fortunate. I was in that position to learn all that, because you get it's easy for you to just palm off everything else, like with insurance, with payments aspects, to someone else, to your boss, to your receptionist, and you don't really deal with that, right? But in your work style, that's part of it, right? Not purely just the dentistry side, right? So for me, like they have equal importance, right? But you don't want to sacrifice the quality of care you're giving and the treatments to your patients at the same time. So, that's why like I'm trying to focus as much as possible on CPD itself. Like, I'm doing a bit more ortho orientated courses now. So yeah, I'm looking forward to that. It's pretty exciting. Yeah.
Yeah, I mean, before we jump into the ortho, so what you're saying is basically that because you had these struggles, particularly struggles that you had at work, that's what compelled you to jump into learning about practice ownership, so you could practice management, so you could kind of reapply that back at work.
Yeah, yeah. You know what, like I do think like that was a big part of it, because like if I had a really structured a practice for me, like of course it'll be easy for me to just focus on every work I'm doing, having everything else palmed off to someone. But because like I was constantly struggling in a way too, like managing the patient, not just in the chair, like the disease in their mouth. It was more like managing them in terms of like what can you provide? Okay, like you can't select the most optimum option. What can we do with the suboptimal option in your situation, and maybe we can work around that. And like if you have a patient that asks you like what can I do for rebates and stuff like that, you feel like you want to have the answers to something like that too, right? And it even comes down to like the materials you have in your clinic. Like, until I started having my own practice and managing it, it's like there's a lot of things like I didn't know, like, with steri and stuff like that. It's so easy for you to just trust what the nurse, your DA is doing, right? But then like if you have to be double checking that, there's a lot of things that you need to manage. And I think like just knowing the in and outs of it makes your practice or like how you manage a patient even better, because you kind of like, okay, like, has this been done the right way? Okay, like I can actually use this on the patient. Okay, I'm not restricted to just this one material that my practice has. Like I have option of choosing there's other materials too. There's just things like that. Like I feel like it really helped for me to gain a really, really broad perspective when it came to practicing. Yeah.
Yeah, I think different people would say that the learning about that is not what they want to achieve in their first year out. But I think what you're saying in your particular situation, you were compelled to do to have to learn about some of that practice management stuff. Otherwise, you couldn't function at the workplace as well as you could have. I think some clinicians or recent graduates would feel like they would be more comfortable trying to get better at their clinical skills. But that's in each and everyone's own journey on that. So let's kind of dive into and one other thing I want to point out is the other thing that you mentioned about, steri. We usually, as recent graduates, maybe just palm it off to the nurse and assume that whatever they're doing is correct. And one thing I would probably say is that for a lot of our listeners as well is that what we don't realize as recent graduates is that you as a clinician, especially if you're an SNFFA, is that you're actually in charge of what goes on at the steri. So it is a very big learning curve that you have to take.
Yeah, I agree with that, because like, coming out as a graduate, it's scary to hear all these legal cases that happens around you, especially in Sydney, a city that's so big. Like you hear of another practice like going down, right? Like because of infection control, or like you hear of a colleague that has been audited, right? And like if you think about it, like if you get audited, like there's so many things that you just are required to know. So why not start at the beginning, right? So yeah, I think that is very important. Yeah.
Yeah, I think when people don't realize is that when they're ticking the boxes on their registration, they're actually ticking a legal document, and a lot of these legal clauses actually refer to these responsibilities as a dentist. But let's move on to your journey into ortho. So tell us about what happens at this point. You're interested into ortho, so what do you decide to do?
So at that time, after I finished the primaries, after I felt like, I focused quite a lot on the basic side of the dentistry, I did have a lot more, I guess like, look, my what I do with CPD is very tailored to what I'm seeing in practice and what my patients want. And I was seeing a lot more family orientated patients, and the practice that I worked out was more family orientated. So, I did have a lot of requests for orthodontic work, right? Even minor ones. It doesn't have to be like full on ortho cases, but because of that, it kind of led me to be like, what, this is something that I want to do in the future. So, might as well start now. And since there's a request for it, and I started looking into it. And the first course I did was a year's diploma course with BOSS. That's with Dr. Tao. And I had a really good experience with that because I was able to just basically apply what I learned directly to the practice. And one of the first things, or in first year, I got the accreditation for Invisalign at the same time too. So, it was just like everything fell in line. So it was a good point to start. Yeah.
Right. There's a lot of orthodontic courses out there. What made you decide that you wanted to do this one in particular?
Yeah, there's so many courses that you can pick from. This was referred to me, or like word of mouth, and also I was quite attracted by the appeal of doing clear aligners to start with. And this course, the diploma course, they seem to offer quite a lot of the clear aligner focus, whereas the other orthodontic courses may teach you a lot more with the fixed appliances. It's very important to learn all the foundations of it. But in terms of what I can deliver, right, it was something that I could directly apply. So, after having that done that, I'd say it's definitely, good for me to actually apply that to the practice. Yeah.
I mean, how would you? Because when people graduate as well, they're seeing, there's fixed, there's removable. How did you decide to go down a particular path?
Um, Whether it's fixed or removable, I think like you need to understand again, like with the fundamentals, like you need to know how to, how teeth moves, the biomechanisms of it, right? And I feel like there are a few courses that do offer that, some probably not as much, but the theory part was going to be really important, and I felt like that was something that I needed first. And to answer your question, like why pick clear aligners or fix first? Clear aligners was something that I felt like it wasn't extreme. I mean, there is an ortho component, of course. You need to understand, know how to move teeth and all that. But at least, like, if you have a patient came in that had like a relapse, or like there was one tooth that needed to be moved, there's many ways to do that. But I just saw clear aligners as something that was very simple to start with, and you don't really need that much accessory tools, right? You just need a scanner, if not a scanner, like impression material. And then most of it is something that most practices can offer for you to start aligners, right? It's something, you can send off and it comes back. For fixed braces, the practices that I had, they didn't really have that full set of ortho equipment, like, a lot of the wires, a lot of the either elastics or like the tools, appliances. So, for me to go to my boss then and be like, can I just have a full set of ortho appliances because I decided to start? It was a bit difficult. So, I mean, that was the reason why I started clear liners. Not to say I won't do fixed braces. I think like there's definitely room for that, and I'm on my journey right now doing more CPD for fixed. But that was just how I started, and definitely no regrets with that. Yeah, so it was a good journey.
Yeah, look, I think it's an interesting point because, for a practice, for an associate, when they're working out a practice, maybe when the practice isn't doing orthodontics, they don't have these kind of things. And it is a consideration when you have to go and either convince the practice owner to purchase these materials or to get it yourself. So I can see where your train of thought was kind of going with that. And I guess it's very dependent on everyone's own kind of situation, whether they want to go into it or not. So, yeah, you sorry.
Just to solve those problems, just get your own practice. You don't have to worry about asking anyone else. You can just get it yourself, right?
Not everyone's like you, George.
Look, I'll add that with the clear aligner course, like coming out of uni, you hear about like Invisalign because it's heavily advertised, but just be mindful that to the new grads out there, that there's so much more aligner systems out there. Like it's not just restricted to one. Don't think that there's only one way of doing clear aligners. There's so many other materials, so many other brands. Something that I learned through the course itself, and there's not just one type of scanner too. There's so many different companies, different scanners. Like, yeah, just keep an eye out for all this, because I think like for you to restrict down to only one thing, like one material, like, one composite resin that you use, like it's not very effective way, for you to learn and try around basically. Yeah.
Okay. What CPD do you feel that you did not implement or was not as beneficial for you at the time, and you will do differently next time?
I think I would have got a bit more out of my surgical CPDs. So I do quite a bit of fair share of surgical extractions. I have started an implant course last year. I have placed the implant under supervision, but it's not something that I'm focusing on now. But in terms of that, like with the surgical component, like I wish I probably did a bit more of that CPD and be able to expand on that a little bit. But yeah, it is what it is now. But like there's definitely room for that in the future. Yeah.
So who's been pivotal in your career path and why?
Uh, it's gonna be hard for me to pick one person, because there's so many pivotal people throughout the different stages, throughout the different phases, of your career, of your life. I'd say at this point, all the bosses, all the mentors I've encountered, since I've graduated, as well as the ones in uni that we've had, but more so in the career pathway, like, since in Sydney and working here, whether it was a good experience or bad experience, there's something that you learn from them. And being a now a practice manager myself, like it's definitely not easy to be in that position. So I'm going to be grateful for anyone that I cross paths with, and for them to teach me their knowledge, basically. Yeah.
So, what do you hope your ideal clinical or non-clinical day might look like in 5 years' time, and what kind of CPD do you want to get to that point? You mentioned briefly about implants, but was there anything in particular?
Well, in 5 years' time, I hope that my practice is doing pretty well by then, and I do want to do a bit more focus on major dental, like definitely have the fixed braces and being a bit more family orientated in terms of the dental practice. Implants, yes, there's gonna be room for that. I ideally like to do that, half the day, like in terms of either ortho or implants, something like that. A bit more major dental during half the day, but I don't want to get rid of like the basic dentistry side. Like I think I will enjoy it just as much. Like even just those checkup consults, or just doing some class one fillings, right? It'll still be a part of an enjoyable day for me. And yeah, there's a lot there's a lot that I want to do in the future. I mean, there's so much that we have time for, and on top of just the dentistry and the clinical aspects, I want to be able to like be a bit more efficient and understanding of staff, like just I guess like more focus on the management as well. Yeah.
You mean on your non-clinical days, you want to be able to do all the admin stuff?
Yeah, pretty much. Yeah, it's like wearing two hats in a way, right? Yeah, yeah.
But how about all your hobbies about basketball and all the volleyball and everything?
Oh, that's can't do anything like that at the moment with the lockdown, but I'm really, really excited to get back into that. Yeah, and then even traveling, like this talks about like borders opening, but I mean it's gonna be a while, right? Since we're gonna be living with COVID in a way, right? Yeah.
That's right, yeah. For some
So
of our viewers and listeners, you probably don't know, but George is like colossally tall. He's like, if he stands in your way, he's like Yao Ming.
well,
That's why we.
I want to say colossal. This, I mean, I wasn't the tallest in our grade, right?
George, tell him how tall you are. Tell him how tall you are.
That you can save that in the notes, right? In the talks, people can ask that question themselves if they want. But well, for those who didn't know, like me and Lawrence, we actually had a travel trip like during this in Adelaide, right, during our final year
Yes.
to Uluru to Alice Springs. So we drove the whole distance from Adelaide down the Stewart Highway. Yeah, so I mean. It's just those travel things that I'm looking forward to, like just travel trips. I mean, I like long distance driving, yeah, and even though I get cramped a little bit in the car, but it's fun.
Yes, that was a limitation on our long drive to Ayers Rock and Alice Springs. It was something I noticed. Good trip, good memories. So just to kind of wrap it all up, what would be some words of wisdom that you'd like to leave for the budding young dentist who's about to graduate?
I'd say it's okay to start slow sometimes. If you come out and you see all your colleagues, your peers, like, gunning it out in certain aspects of their either CPD, what they're passionate about, they're going to different hobbies or like just, a whole new world, basically. It's okay if you're not there in the first year. I think like most important thing, just as I said earlier in this podcast, just focus on your basics, your fundamentals. Once you get that done, there's honestly nothing else that can go wrong. And, you're working in dentistry. It's a really good field with a lot of good support, and you've got so much years ahead of you. So there's no point rushing and compacting everything into that first year, right? So, listen closely to what people have to say, but apply it to yourself and make sure that what you're doing is comfortable, not just because someone else told you to do it, especially your bosses too. Like I know there's people that get into sticky situations because of that. I've heard a lot of stories myself and us from colleagues. So yeah, it's okay to go at your own pace, basically. Yeah.
So, Dr. George Chen, this is kind of formal, but thank you for coming on the show today. If you could let the people know how they can find you or what you've got going on in your life.
Well, thanks, Lawrence. Well, I have a personal Instagram page. It's nothing fancy, but I recently uploaded some videos of me playing piano on there, so you guys can check it out. It's at George's. That's how you say it, but yeah, it's basically George times 2. I don't know why I made it, but I mean that's one way of reaching out to me.
It's okay. You don't have to explain it. We accept you for who you are. So, for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you on the next episode of CPD Junkie Podcast. Thank you.
Thank you.